Welcome, medical students, to today's lecture on the topic of obstructive sleep apnea, OSA. In this comprehensive script, we will delve into the intricate details of OSA, its pathophysiology, diagnostic modalities, treatment options, and various associated factors. Additionally, we will explore the impact of OSA on other medical conditions and discuss emerging therapies and future directions in the field. Let us begin our journey into the world of OSA. Obstructive sleep apnea, OSA, is a condition characterized by recurring closure of the upper airway during sleep, causing breathing disruptions and decreased oxygen levels. Factors like anatomical abnormalities, neural control dysfunction, and reduced muscle tone contribute to the development of OSA. Obesity and neurochemical imbalances further exacerbate the condition. Knowledge of these complex mechanisms is essential for effective treatment. During sleep, respiratory function is altered in individuals with sleep apnea. Apneic episodes cause sleep fragmentation, intermittent hypoxia, sympathetic activation, inflammation, oxidative stress, and endothelial dysfunction. Severe cases may also result in hypercapnia, impacting gas exchange and leading to cardiac and cerebral complications. In this section, we will discuss the various diagnostic tests used to assess sleep apnea. These include polysomnography, home sleep apnea testing, and portable monitoring devices. Each test has its advantages and limitations, and the choice depends on factors such as patient preference and resource availability. In the section on treatment modalities for obstructive sleep apnea, OSA, various options are explored. Continuous positive airway pressure, CPAP, therapy is the first-line treatment, while oral appliances, surgery, and lifestyle modifications are considered for different severity levels and patient preferences. Obesity is a significant risk factor for sleep apnea. Fat deposition in the upper airway narrows it and increases resistance during sleep. Weight loss is an effective treatment as it reduces fat around the airway and improves respiratory muscle function. Obesity management is important in sleep apnea patients. Although obesity and anatomical abnormalities contribute significantly to OSA, a growing body of evidence suggests that genetic factors also play a role in the susceptibility and development of sleep apnea. Family studies have revealed a higher prevalence of OSA among first-degree relatives of affected individuals, suggesting a genetic predisposition. Twin studies further support a genetic influence on OSA, with monozygotic twins having a higher concordance rate for OSA compared to dizygotic twins. Genome-wide association studies have identified several candidate genetic loci associated with OSA susceptibility, including genes involved in neural control, inflammation, and adipose tissue regulation. Understanding the genetic factors associated with sleep apnea helps researchers elucidate the complex pathogenesis of OSA and facilitates the development of targeted pharmacological interventions and personalized treatment approaches. Sleep apnea affects cognitive function and neurobehavioral performance. It impairs attention, memory, and other abilities, impacting academic and professional performance. Daytime sleepiness increases accident risk. CPAP therapy improves cognitive function and alertness, emphasizing the need for treatment. Sleep apnea is closely intertwined with the development and progression of various cardiovascular diseases. Individuals with sleep apnea have a higher prevalence of hypertension, arrhythmias, and heart failure, which can significantly impact morbidity and mortality. Intermittent hypoxia, sympathetic activation, systemic inflammation, oxidative stress, and endothelial dysfunction resulting from sleep apnea contribute to the pathogenesis of cardiovascular diseases. Effective treatment of sleep apnea, particularly with CPAP therapy, has been shown to alleviate cardiovascular comorbidities and improve clinical outcomes. Recognizing the cardiac complications associated with sleep apnea helps clinicians adopt a comprehensive approach to patient management, including cardiovascular risk assessment, and reinforces the importance of treating sleep apnea as part of cardiovascular disease management. Understanding the relationship between sleep apnea and coexisting sleep disorders is crucial for comprehensive patient care. Restless leg syndrome, insomnia, and periodic limb movement disorder are frequently observed in individuals with sleep apnea, exacerbating sleep disruption and daytime symptoms. A multidisciplinary approach is necessary for managing these coexisting disorders. Pediatric sleep apnea is characterized by recurrent upper airway obstruction during sleep. It can be caused by adenotonsillar hypertrophy, craniofacial abnormalities, obesity, or neuromuscular disorders. Clinical manifestations include growth impairment, enuresis, behavioral problems, and academic difficulties. Adenotonsillectomy, weight management, positive airway pressure therapy, orthodontic intervention, or maxillomandibular advancement are treatment options. Early identification and management are essential for optimal outcomes. Anesthesia management in individuals with sleep apnea requires special considerations. Preoperative screening, evaluation, and stratification of risk help identify high-risk patients. Intraoperatively, maintaining airway patency and ventilation is crucial. Postoperatively, pain management, respiratory monitoring, and early extubation minimize complications. Anesthesia providers must be familiar with these challenges for optimal patient care. Emerging therapies for sleep apnea, such as upper airway stimulation devices and pharmacological interventions, show promise for improved treatment options. Individualized approaches based on genetics and phenotyping could revolutionize sleep apnea management in the future. In conclusion, we have covered various aspects of sleep apnea, including its mechanisms, diagnosis, and treatment. We have also explored related factors and challenges in different populations. Overall, this video aims to provide a thorough understanding of sleep apnea for effective patient care.